Hello, I'm Dr. Robert Shapiro from Shapiro Holistic Health and Chiropractic in Stockton, California. And today I wanted to discuss with you what is functional medicine. Functional medicine is a revolutionary new way of treating patients that involves bridging the gap between traditional medical care and optimal wellness or fitness care. We bridge that gap utilizing holistic methods primarily. The way that works is when you call us and you want to schedule to be evaluated as a patient under the aspects of functional medicine, we go through a multi-step process to take you from point A to point Z. The first step is to establish what your particular condition or issue is. At that point, we're going to issue to you multiple questionnaires along with paperwork to document your extensive medical history. We're going to bring you in the office to discuss the details of those questionnaires, ranging from do you have hair falling out, to how are your bowel movements, to what's your dietary intake like, to are you satisfied with your weight and your energy levels. A multitude of different questions and possible conditions or diagnoses. We're going to look at the history that's important to you, and we're going to focus in on what we know we need to focus on. And if appropriate, we're going to run a battery of medical tests, primarily ranging in the functional blood chemistry tests. Most medical doctors run blood tests in small panels, and they tend to reduce or reductionize the way they deliver health care. In holistic medicine, we like to look at the big picture. So when we run our blood chemistry panels, we run very extensive panels. We'll go into the details of those panels in future videos. But suffice to say that most of the patients that come in our office tell us over and over again that the tests that we run on them are much more detailed and thorough than what their regular doctor has ever ran on them. We take the results of those blood tests, and if appropriate, we analyze and render an appropriate assessment and nutritional plan for that patient. And they're always custom and individualized based on your particular needs and your goals that you want to achieve. Sometimes those goals are to eliminate the effects of a disease process. Other times those goals are, I'm getting symptoms, but every doctor that I go to tells me that I'm perfectly normal and all my lab tests are normal. Most of the time what we will discover with them is that those lab tests are in fact not normal, even though the numbers that they're registering are well within the established ranges of that particular test. And I'm sure if you're watching this video right now, you've probably ran into this particular situation. I don't know how many times a patient will come in our office and say, my doctor says that I'm fine, but I don't feel fine. We will look at those blood tests under a much more detailed microscope, if you will, or magnifying glass. And we will provide you with optimal ranges along with the critical ranges. And that's the big difference between traditional or conventional medicine and functional medicine, because we like to be more precise and get our patients as close to optimal health and performance versus, oh, you're within the ranges, so everything's fine. Come back to us when you have a full-blown disease so that we can put you on medication for the rest of your life. That's not what we're looking to do. Don't get me wrong. There are times when medication is absolutely appropriate. You have to understand the purpose of medication, the original purpose, not today's purpose, because there's a very big difference. The original purpose of medication was to get you out of crisis and to save your life that day, to basically keep you from dying. The modern reason for medication is profiteering, almost 100% of the time. I've spoken to numerous pharmaceutical representatives, and they've told me from their own mouths that 95% of pharmaceuticals are designed for a patient to be on for the rest of their life. Now think about that for a moment. For the rest of your life. Do you really want to be on something for the rest of your life? I know people that don't want to be on supplements for the rest of their life, let alone medication, which are always toxic, and at some point they're harmful for you, even the stuff that's designed to save your life. So why would you want to be on it for the rest of your life? It's a good question. Unfortunately, not enough people ask that question in time to save themselves from years of torture and anguish. Thankfully, though, many are starting to, and they're seeking the assistance of educated functional medicine practitioners such as myself. When you come into our office, we're going to look at the details of your lab tests. We're going to run additional tests such as hair testing for heavy metal analysis, or digestive testing to analyze the bacterial cultures in your digestive tract to make sure that you don't have an opportunistic bacterial infection in your GI system causing things like leaky gut or bowel inflammation, irritable bowel syndrome, etc., etc. We're going to run saliva tests to assess the status of your essential hormones, because a lot of people have hormonal problems and unfortunately they're not being addressed appropriately. Probably the single most common hormonal problems that we run into in our office are menopausal issues or thyroid problems. We address these all the time and we do it holistically. If necessary, we might even turn to muscle testing to determine the needs of your particular situation. Hopefully, you've gotten a pretty good overview of what it entails to go into the world of holistic and/or functional medicine. I want to thank you for stopping by and checking our video out, and please come back as we will be uploading more information all the time. Thank you.